I've been practicing chiropractic over 30 years. I graduated chiropractic school in Marietta, Georgia in 1980 and had my first practice in Kenner, Louisiana, right outside of New Orleans in 1981. And moved to wonderful Dallas, Texas in '89, and I've been practicing here in Dallas ever since. I believe a new patient should come see me because I'm an experienced chiropractor. I've seen thousands of people with thousands of conditions, whether it be neck, mid-back, low back, shoulders. And I'm an experienced doctor that could evaluate and determine the diagnosis and the treatment plan for a new patient that would come into the clinic. And also, I would manage the person correctly, and if other physicians would have to be involved, whether it be medication or other procedures, then I would recommend that as well. This is a lumbar distraction table, and what this allows it to do is get circulation into the discs. Okay, the disc is the pad in between the vertebra. Okay, it's made up of fibrocartilage, 60 to 80% water, and the discs make up a third of our height. So we want to make sure that we get circulation of blood and nerve supply in the discs by keeping the vertebrae in motion. And that's one of the preventions of getting chiropractic on a regular basis, every 2 or 3 or 4 weeks, whatever the chiropractor recommends. As you can see, there's no pain to it. It puts motion into the vertebra, into the lower back, and into the discs. And it's very necessary to keep people healthy. So what we have here is a lot of the patients come in because they're on their iPods, they're on their laptops, and they tend to be leaning forward with their shoulders, strengthening these muscles and strengthening the muscles in the front of the neck. So to reduce the probability of them having a problem in the future and leaning forward, we want to strengthen up the muscles in the back here of the back as well as in the neck. This particular exercise is going to strengthen up these muscles, and Juliana will demonstrate that.
This is a row, and you're squeezing your shoulder blades together and pushing your shoulders towards the floor at the same time. You're trying to squeeze a penny roll between your shoulder blades. It's the rhomboids that you're strengthening. And you can also cross them and pull out like this and bring your elbows out, and that's going to work posterior deltoids, which is the back of the deltoid. So if you get your deltoids and your rhomboids stronger, you're sure to get your shoulders back and your posture more upright. These are back extensions, and I also do Y's for the posterior deltoids, T's to squeeze the shoulder blades together, W's where you reach your elbow out and back, reach your elbow out and back, I's, and reverse flies. All of these are meant to strengthen your back. And the rule of thumb is to exhale on the hard part. So as you go up, you exhale and pause at the top each time. And I would do about 10 reps of each of those exercises. So we got the Y's, the T's, the W's, the I's, and the reverse flies.
This is the reverse swing, which is very comfortable for the patient. And what it does is it helps again to get the pressure off of the discs. So Julianne's going to lay back here, and we're going to bring it back like this, very comfortable. Usually I let them take their time, so the blood supply to the head is not that quick, so they don't have a rush of blood supply. Once they get used to it, and Julianne has done this before, so this is something where I can bring her back. Again, I only allow it 60 degrees. I don't recommend go any more than that, because then you put stress on the ankles and on the knees itself. So now this is taking the pressure off of the discs, and usually I'll just lift this up just a little bit to make it a little bit more prominent in the low back, and we keep them here anywhere 3, 4, 5 minutes, And sometimes I'll bring them up like that so they can get used to it again, and then I bring them back. Very effective, and the patients really love it. Okay, this is a very interesting chart, but because before I got this chart, I had to show my patients 4 pieces of paper describing actually what you're looking at. And this is a dermatome, or where the nerve roots come from the spine, and it lights up in the areas that it's affected. This is the actual spine. This is the brain that sits inside in the extension of the spinal column, and these are the various organs that it affects. So if people come in with headaches, we'd have to look up in the upper area of the spine and see how that affects. We also have people that come in with digestive problems, which is in the mid-back here, part of the spine. As you can see, it goes into the stomach and the GI tract. We also have patients that come in with low back problems that affects their low back, pain-wise, shooting into the legs, but also they may be urinating more or less. Also with females, they may be having problems with their menstrual monthlies, and they don't understand why. Also, they might have had an epidural during one of their bearing a child, which means that the ligament in the lower back might have been disturbed, which makes the lower back unstable, and chiropractic is the most natural to correct these type of problems. But it's been very exciting over the years to be able to work on people and get them better, and this chart has really helped to explain to people actually what's going on besides the pain, other conditions that it could help.